Health benefits of intermittent fasting, a complete beginner's guide. Intermittent fasting is a dietary regimen that varies between fasting and eating on a daily basis. It has been shown that this is a means of maintaining your weight and avoiding certain types of sickness or even reversing it. It ensures that you feed only at a particular period, helping your body to burn fat as you fast for a certain amount of hours per day or consume only one meal a few days a week. If you enjoy these types of videos on health tips and information from medical professionals, consider subscribing to our channel and click the notification bell for more future videos. It is crucial to check with your doctor before commencing intermittent fasting. You may use a regular diet plan that limits your daily eating to 6 to 8 hours per day. For example, you can decide to try fasting for 16/8, eating for 8 hours and fasting for 16 hours. Over the long run, most individuals find it easy to adhere to this pattern. You can adjust the number of hours in this strategy to suit your weight loss needs. Another, known as the 5-to-2 meal plan, entails eating for only 5 days a week. You restrict yourself to a daily 500 to 600 calorie meal on the other 2 days. You could decide to eat regularly every day of the week except Mondays and Thursdays, which would be your single meal days. Longer stretches without food are not inherently healthy for you, such as 24, 36, 48 and 72-hour fasting periods, and can be harmful. In reaction to hunger, going too long without eating might potentially cause the body to start storing more fat. Health benefits of intermittent fasting. 1. Improved metabolism. The human body isn't really built to have 24-hour food access. Our bodies have adapted to survive cycles of deprivation, and scientists now recognize that during periods of fasting, the body changes its metabolism. Our body burns glucose for energy, but if carbohydrates, which break down into glucose, are not accessible, it uses stored fatty acids and ketone bodies to generate glucose. This method is called ketosis, and it is a powerful way of generating energy. Metabolism can be strengthened by eating meals early in the day and extending the nighttime fasting time. 2. Improved blood sugar regulation. Scientists have recognized that intermittent fasting contributes to healthy levels of blood sugar, but they were not sure if the increase resulted from weight loss or specifically because of the fasting method. Researchers calculated the calorie requirements of 8 pre-diabetic males to find the answer and allowed these men to consume those calories between 8 a.m. and 2 p.m. over 5 weeks. The men did not lose weight, but they significantly improved their blood sugar levels. 3. Weight loss. Individuals who follow an alternate day fasting schedule usually lose about 3 to 8% of their body weight over 3 to 12 months, while consuming around 500 calories a day and only eating as needed the next day. For some individuals, intermittent fasting is preferable to other diets which require daily calorie counting. If you dislike counting calories, your key to weight loss might be intermittent fasting. 4. Improved blood pressure. Doctors have long found that a lot of individuals who fast frequently, as a religious ritual, have healthy hearts, causing some to ask if prolonged fasting could be a method that could avoid and possibly treat heart diseases. At first, the reason was not clear because religious people usually prefer to live reasonably safe lives, fewer heavy smokers or drinkers, so their robust heart health was possibly because of prohibition, or moderate use, of cigarettes and alcohol. Since then, medical experiments have shown that prolonged fasting can reduce blood pressure and can be used as an adjunct to the treatment of elevated blood pressure. 5. Reduced inflammation. Cells within the body respond to intermittent fasting by going into repair mode. Inflammation tamps down, a risk factor for heart disease and diabetes. The body does not have time to turn to a fasting and repair state while people eat daily, which may be one reason diabetes and heart disease are so much more prevalent now than they were even a century ago. 6. Neuro-protective effects. The body burns ketones for energy during times of intermittent fasting. The expression of a protein that promotes the development and survival of neurons, specialized brain cells that send nerve impulses, is induced by ketones. Some animal experiments have shown that intermittent fasting can boost the memory and capacity of animals to navigate obstacles. Improvements in auditory memory have been reported by 2 studies, and at least one has also shown improvement in general thought. 7. Cancer defense. Intermittent fasting may not cure or prevent cancer entirely, but interesting evidence shows that reducing food intake may delay cancer development and growth. Many animal studies have shown that alternate day fasting reduces the occurrence of tumors. Animal studies also show that fasting will delay the development of existing tumors and improve their chemotherapy and radiation exposure. Scientists are currently researching the role of intermittent fasting in patients with breast, ovarian, kidney, endometrial, colorectal tumors, and glioblastoma, a form of brain cancer. 8. Reduced cholesterol. Regular fasting has been shown to reduce blood levels of the so-called bad cholesterol, low-density lipoprotein, or LDL cholesterol. It associates an increased risk of heart disease and stroke with elevated LDL levels, so physicians advise patients to maintain their cholesterol levels under safe limits. Patients have discovered that intermittent fasting helps them, without conventional medical treatment, to lower their cholesterol levels. Who should not practice intermittent fasting? You can check in with your primary care doctor first before you attempt intermittent fasting, or other diets. These persons should keep away from attempting intermittent fasting. 1. Infants and youth under 18 years of age. 2. Women who are breastfeeding or pregnant. 3. People with diabetes. 4. People with a history of eating disorders. Cons of intermittent fasting. 1. Interferes psychological aspects of feeding. For social events around food, the reduced eating window during intermittent fasting may present a challenge as participants may not dine with their family or friends because of their restricted eating intervals. 2. Low energy levels. In order to sustain our energy levels, having enough fuel during the day is critical. With that in mind, following a time-limited eating schedule may impede people's everyday activities and productivity. 3. Binge eating. If intermittent fasting leads to an unpleasant level of appetite, this could cause certain people to consume more than they would usually eat when their eating window eventually opens up. 4. Digestive issues. After consuming large amounts of food in one sitting during their eating windows, certain people may feel some levels of digestive distress. 5. May cause disordered eating. We do not recommend intermittent fasting for those with a history of an eating disorder, as it has been shown to have a high association with bulimia nervosa and may exacerbate symptoms in patients with an established eating disorder. 6. Potential increase in weight. It may lead to some physiological changes in the body to minimize energy consumption. These changes may eventually lead to an increase in fat deposition and storage, causing weight gain. While intermittent fasting may have several possible health advantages, the evidence is highly mixed and minimal. Although intermittent fasting is a more versatile alternative to a calorie-restricted diet, it may not be a suitable match for everyone, particularly for those who have an eating disorder. It could, however, be more fitting for those who excel and feel their best eating larger meals later in the day, rather than those who enjoy more regular smaller meals. Please see the links in the description below for more resources. Until next time, thank you.